The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem. Welcome to Talk Tuesdays, brought to you by My Virtual Physician, a direct-to-consumer, multi-specialty telemedicine company that operates in multiple states. Welcome everyone, thank you for joining us today. My name is Stephanie and I'm part of the team here at My Virtual Physician. We are a direct-to-consumer, multi-specialty telemedicine provider operating in multiple states. It's Talk Tuesday, and we are back with our weekly educational series, talking with experts, exploring some common healthcare concerns, and hopefully answering questions that you have. Today, we have back on Dr. Ginger Coleman, and she is talking with us about EGDs. So last week, when we talked about GERD and acid reflux, you mentioned a procedure called an EGD, and that we would talk about it more this week. So can you tell me what it is?
Yeah, so an EGD is an abbreviation for a word I really, truly struggle to say, and probably why everyone calls it an EGD or an upper endoscopy, but it stands for esophagogastroduodenoscopy. I know, right? So EGD, much easier.
Yeah.
Anyway, it's a procedure, this procedure is how a physician can look at your esophagus, your stomach, and your duodenum, which is the first part of your small intestines that's connected to your stomach. It allows us to see ulcers or irritation, inflammation, tumors, bleeding, etc. In any of those areas by using a small camera that's on the end of a flexible tube. So it sounds a lot scarier than it actually is, I promise.
Yeah. So can you explain what actually happens and what to expect?
Yeah. So, normally it's an outpatient procedure. So that means you come in the day of and you leave maybe an hour or less after the procedure is done, assuming that there's no complications, and we can discuss complications later, but major complications are not very common. You come in, you're seen by a nurse, and you have to put on a gown and get your heart rate and blood pressure and all your vitals checked. And then you're going to have not only the nurse, but the gastroenterologist or the surgeon or whoever the endoscopist is that's doing the procedure, and possibly even an anesthesia provider that all see you, and they're all going to ask you the same questions. Any medical problems, reason that you're having the procedure, any allergies that you may have to medications, when the last time you ate was, all sorts of things. And they're all going to ask you the same thing, but then they may ask you a couple different, but you're going to feel like you're repeating yourself. You're given instructions prior to coming in for the EGD, where they tell you not to eat or drink anything anywhere from 8 to 24 hours beforehand. They may ask you to stop taking certain medications like blood thinners or aspirin, but that's all going to be personalized to your situation and what the endoscopist, prefers, whether it's 8 hours or 24 or whatever. After you talk to all the people and repeat yourself, they'll take you into this small procedure room where the EGD actually takes place. Some physicians prefer to do these with the assistance of an anesthesiologist, and some prefer to do their own sedation. So either way, you're not going to remember it. The next thing after the procedure, you're going to be in recovery and have no recollection of what happened. So when you get in the room, everyone stops what they're doing. We say your name, what the procedure is that's being done, and so that everyone knows we're doing the correct procedure on the correct patient. After that, you're given medication, and it'll make you tired, and you kind of just forget what's going on. You might not be fully asleep, and a lot of times people will talk to us, but you're not going to remember any of it. I've heard that there are some physicians that don't use any medication for sedation, and they really only like numb the back of your throat with some like lidocaine spray or something. But I've never seen that, so I don't really know how common that is. I think most people use medication. But once the medication's given, they put this little plastic block in your mouth with a hole in the center of it. And that's called a bite block. And it really just keeps you from damaging the scope with your teeth and clenching down on it. So the scope is about the size of or like the width of your finger. There's a light and high-end cameras at the end of the tubing. And so once you're asleep, we put the camera through the bite block and it goes down your esophagus. And like I said, a lot of times people are still awake, so we're able to ask them to swallow it. But they don't remember doing any of it. You can still just follow instructions. So with the camera in your esophagus, we can look for all those things I mentioned earlier, like ulcers and irritation. But we can also take pictures and biopsies of anything that looks concerning or suspicious, even normal things, just to prove that everything was normal. But we do this sort of backwards, and we look at the esophagus last when we're on the way out. So on the way down, we just want to get into the stomach. We look all around, take pictures, take biopsies, and then we go through the pylorus, which is the muscle that separates the stomach from the small intestine and helps regulate how much food gets released from your stomach once it's been digested. In the small intestine, we look for the opening of where your common bile duct comes from your liver and joins your pancreatic duct from your pancreas. And that drains into your small intestine through this little tiny hole. And so we try and look for that, make sure it looks normal, and look for any, other little polyps or tumors or signs of disease like celiac disease. And we can take biopsies of any of that stuff. So then once we finish that, we pull the camera back into the stomach, take another look around, and then we bring the camera into the esophagus, and that's when we examine the esophagus. Once the camera comes out, the bite block's removed, you go to recovery, and usually you go home in about an hour. Just kind of depends on the, protocol of wherever you're having it done. You'll be given instructions and told what was found or if everything was normal. But someone's going to have to drive you home because you're going to be still kind of out of it. So they are also given those same instructions and information because you probably still won't remember anything we tell you. So then if biopsies are taken, and I guess even if they're not taken, we usually see you back in clinic in about 2 weeks or so, and that gives us time to get the pathology back and kind of go from there.
Okay, so it seems like a pretty easy process, but you mentioned some complications. So can you explain those?
Yeah, so some of the complications can be just like an adverse reaction to the medication, an allergic reaction, redness or pain around your IV site. And that's part of why you have so many people asking you about allergies and things beforehand, because we want to make sure that we don't give you something that you're allergic to and we just haven't, we didn't know it beforehand. You can have some bleeding from biopsy sites. It's not common for the bleeding to be severe, and it will usually subside on its own. And if something does bleed, it usually bleeds during the procedure and we see it. And if it's bleeding a lot, we can, inject it with something to make it stop bleeding. It's not really very common for it to bleed afterwards. Aspiration is kind of a more serious concern, and that would be something that tends to happen during the procedure, but it's when you inhale into your lungs the contents from your stomach. So it can result in a pneumonia and other lung complications, and that is why it's so important not to eat or drink before your EGD. And if you did, it's okay, just be honest, because we may just need to push it back, another hour or so, and do someone else's procedure before you, or just reschedule it in general. But it's not something that you really want to risk dealing with. Really the most serious complication is that the scope can put a hole in either your esophagus, your stomach, or your small intestine, either from pressure from the scope itself or from a biopsy that was maybe a little too deep. And so that's also what we call a perforation. If a perforation is noted, or, we're able to tell that it happened during the EGD, and depending on where it is, sometimes it can be clipped and you would just be monitored in the hospital overnight, and a clip really just closes the two edges of the hole together. Mm-hmm. But a lot of times it isn't noticed at the time of the procedure, and it can be in any of those three locations. So a perforation can result in some serious complications and even death if you don't call your doctor or come to the ER immediately when you're having some concerning symptoms. A perforation usually results in an operation, and that operation can be either in the neck or the chest or the abdomen, depending on where the perforation is. If it's at the top part of your esophagus, it'll be in your neck. If it's in the middle or lower part of your esophagus, it'll be in your chest, and then anywhere else, your stomach or small intestine, it'll be in your abdomen. And so when you have an operation, you're going to be in the hospital for several days, and you may need additional operations, really just depending on what's going on. But a perforation's a really serious, but thankfully rare complication of this procedure. Symptoms that should prompt you to come back to the ER or call your doctor and seek immediate medical attention would be things like severe abdominal pain. That's worse than just like regular gas pain. And everybody knows what gas pain is. A firm and distended abdomen, severe abdominal pain severe abdominal pain with movement. That's more than you should have by just moving, right? Persistent vomiting, a fever, difficulty swallowing, or severe throat pain. And then also, you can get this sort of crunchy feeling under the skin of your neck. It actually feels like Rice Krispies. That is a sign of perforation. Come to the hospital. And then obviously, if you start vomiting blood, or you notice any bright red blood or even black material in your vomit or in your stool. So I know it all sounds really scary, and like only the bad things can happen, but I promise it's really not that bad. I actually had one done a few years ago, and I didn't have a bad experience at all. I don't really actually remember anything. I went in the room. I remember being super happy and laughing and joking with everybody, and then I woke up in the recovery room. If they take biopsies of your stomach, don't drink coffee or eat spicy food after, because I made that mistake and it's not great. It's not fun. Don't do that. But really just, as with everything that we've talked about, just talk to your doctor about your concerns, ask questions beforehand, and please don't be afraid to ask questions about the procedure, what to expect, what you need to do, and anything you don't understand or you want more information about, because the more you know and the more you feel comfortable with what's going on, the better it is for you. And it's our job to explain any and all of this stuff anyway. So just remember, everyone's different. So whatever worked for your friend or your neighbor and whatever issues or complications they had don't necessarily apply to you. So just talk to your doctor about what you need to do and what's best for you.
Yeah. Well, thank you so much, Dr. Coleman. You've given us some great information about the procedure and about GERD last week. I appreciate you joining us for Talk Tuesday and telling us what we need to know about everything to do with acid reflux. For everyone else joining us as well, this has been Talk Tuesday with my virtual physician. If you would like to talk to one of our board-certified physicians about your healthcare concerns, including GERD, or getting recommended to go see someone for an EGD, you can check out our website at www.myvirtualphysician.com. We look forward to talking with you again, and we hope you have a great week. The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem.